Let's apply an NG tube as ordered. So make sure your patient is in a high Fowler's position. So raise the head of that bed up. Going to apply a linen saver. We're going to prepare our patient because this is kind of an invasive procedure for them. So we need to prepare them so they are not startled and that they know what to expect and what to do. So we want to first establish a hand signal. So if anytime you feel discomfort or that you need me to pause the procedure, just raise your hand and let me know. So make sure you establish that hand signal is very important. We're going to, of course, do our abdominal assessment prior to putting the NG tube in, review our orders, and establish the need for one. So now we want to just kind of talk to the patient about what we're going to be doing. I'm going to be putting a tube down your nair. So I need to know which side of your nose is more patent than the other, more open. So can you occlude one nostril and breathe in, and occlude the other and breathe in? And which one is more clear? Okay, that's the side we're going to use. Have you had any nasal surgeries? Do you have any nasal polyps? Do you have any septum deviations? So any looking for any abnormalities in the nose, any fractures of the nose, and then take a look. So just take a look and inspection with your pen light, just check and make sure everything's okay there. So when I get to the back of your throat with this tube, I'm going to need you to bend your chin down to your chest and then take some small sips of water. And I'm going to say swallow. So you'll swallow every time I am inserting the tube. And that will help the tube go down easier. But really what it's doing is blocking off the airway. And as they swallow, they're basically swallowing the tube down into their esophagus, which is where we want it to go. So we've established our hand signal. I'm going to give you a washcloth in case you need to wipe your nose or anything. You take an alcohol pad and wipe the top of their nose off because we're going to need to put tape on there and we want to remove oils off their nose. Let's get things ready. So get a piece of tape, or some places have stat locks. You're going to take about 3 inches and then tear most of that. So about 2/3 of it. Okay, then you'll need about 3 more 2-inch pieces, 2 to 3 inch pieces. Make sure your bedside table is clean if you are using the bedside table to put your tape on. You want to clean it with a sandy cloth and let that rest for the dry time that your sandy cloth says to dry. So that way you're not contaminating your tape with any organisms. Hand your patient an emesis basin. So in case they might gag or vomit, just warn them that this procedure can make you cough and gag. That's normal reactions. It can make you tear up. But if anytime you feel uncomfortable, let me know. Okay, so we have our NG tube. This one is a Salem sump tube. It's dual lumen. I'm going to put gloves on. This is not a sterile procedure, so normal, regular gloves are fine. You need to have a cup of water with a bendy straw. You need to have a little cup for your specimen to test your pH paper. Let me redo that tape. You need a 60 cc syringe, pH paper, lubrication, and tape, or your stat lock. Apply your linen saver or a towel, sometimes both. Okay. I'm going to take out your tube, and you notice it curves like this. So that's the way we want to put it in. Now we're going to measure how far do we put it in. So tip of the nose, the earlobe, so the bottom of the ear, to the xiphoid process. And that's the NEX measurements, and that's how far we go. So you'll need to mark that spot with either tape or a Sharpie. Okay. Now you're going to lubricate the end of your tube. You want to clamp this because if you don't, gastric contents will come up through the tube. We don't want that. Okay. So you're going to lubricate your tube. About that much. Okay. So we decided that the right narrow was more clear. All right. So here we go. I'm going to go, I'm pointing up at this point, and then I'm going to be curving downward. So pointing up, and now I'm curving downward. Okay, back of the throat is met. Sir, can you pull your chin to your chest? Give them the water. Okay, I need you to take small sips of water, not big gulps, small sips. Okay, swallow, push. Swallow, push. Swallow, push. Swallow, push. Swallow, 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 swallow. And that's as far as the mannequin goes. Okay, swallow. All right, once you get, well, I guess it's going to keep going. All right, you want to hold it here. Don't let go. You want to check the inside of the mouth. Open your mouth for me. Okay, make sure it's not curled up in the mouth. And if you look in my mannequin, it did curl up in the mouth. And that can happen to people too. And you'll definitely know that when they start gagging and stuff. So if that happens, you're going to pull it back. Okay, and then you're going to do it again. Reinsert. Okay, so swallow, swallow. Okay, so that's as far as my mannequin goes. Okay, so all right, so we're good. So after you have gotten to your marking, you're going to grab your tape. Don't let go. If you let go, your patient is going to do a couple of things. They're going to gag and it's going to come out. They're going to pull it out. So you don't want that to happen. So if you let go, it's going to move because as the patient breathes or heaves, the tube will move in and out with the momentum. So you want to make sure that you've dried off the nose, that it's not greasy, and apply tape that's basically temporary. So you may not be applying your stat lock just yet. You wrap this around the tube, going one way and one the other. All right. So wrap your tube. Take a shorter piece and to secure it. Don't go on the eye socket though. Now take this part. Where did all my tape go? Okay. Okay, this part, you want it higher than the stomach. If it's lower than the stomach, then you're going to have gravity pull the gastric contents out. So we will tape this up here in just a second. So now we're going to check placement. You're going to pull out some gastric secretions, clamp your tube, put it in your little cup. Okay. And depending on if your patient's on suction or not, or they're getting feedings, depends on what you do with the rest. So we're going to plug this back in. And now I'm going to set it up here and tape it on the shoulder above the stomach. Okay, over here, I'm going to check placement by doing pH paper test. So I have pH paper and I'm going to check the contents. It should be less than 4. So 4 or less is what the number will be, and it should equal out to that. Okay, after you have checked placement with one, looking at the aspirate, it looks like gastric contents. 2, the pH paper confirms that it is the right pH for stomach contents, acidic. And then before we use the tube, we're going to confirm placement with the x-ray. So now we're going to schedule an x-ray for the patient to confirm placement. So after that is done, then you will just have your patient relax and then follow your orders after that. Clean up your mess and wash your hands and document. So what are you going to document? You're going to document how the patient tolerated the procedure, what the checking was. So we got aspirate out, the pH was this. We put in a Salem sump tube, and it is a 12 French, I believe. So it should say it on your packaging. It should say it on your product somewhere. So 12 French was placed in the right near. The patient tolerated well, secured with tape, an x-ray ordered. That's it.